Hello everyone, Mabel here. In this video, I will be demonstrating how to initiate an IV piggy bag. First, I'm going to ensure that my order, which of course is vancomycin injection, is compatible with the primary infusion solution. And right here, I have my primary bag that is running normal saline. So now I'm going to see my patient. I'm going to introduce myself, then I'll identify my patient using two identifiers. That is asking their full name and date of birth. Then I'll explain the procedure to the patient. Now I'm going to compare my order to the MAR for the third time. Reason being that I had already compared the order in the medication room. Okay, I'm going to assess the patient's IV site to make sure there is no infiltration or swelling. And also I'll be asking my patients if they have any pain. So I'm going to wash my hands and then I'll put on my gloves. The reason why I'm putting on my gloves is to minimize the risk of any infection or any contamination. So I'm going to spike my bag with the secondary administration. So I have my bag here. For demonstration purposes, what I'm using is already spiked. You can see it here. If I had to, then I'll just take it out from here and do it, but that is what I have for my demonstration. So I will affix the needleless cannula to the end of the secondary tubing, which of course was supposed to be right here, just where the drip chamber is. And then I will also I'm going to use antimicrobial wipes to clean this pot. This is my pot. So I'm going to use my antimicrobial wipes and then I'll clean it. And just so I don't forget, I'm going to use my normal saline to flush immediately, just to ensure patency. And then I'm going to insert my needleless cannula for the secondary piggyback tubing into the primary tubing port right here. So I'm going to insert that like that, and then I'll clamp it. Now I'm going to hang the bag, which I've already done, and then I'm going to use a tourniquet like this. So then I'll temporarily place the secondary bag lower than the primary bag, allowing the primary solution to flow. So I have my piggy bag right here, and then I have my primary bag here. So this is my secondary. Now I am going to make sure that the bag is lower than the secondary, is above the secondary bag, the primary bag. This is to allow the primary solution to flow retrograde into the secondary bag tubing. Now I'm going to allow a bag flow until, so if I were to do this, there's going to be a bag flow into my primary bag, and then after I do that, I'm going to bring it back up. So this, I'm going to allow that bag fill until the secondary tubing chamber is about 1/3 full. Then I I will clamp, then I will clamp the secondary tubing right here. I would have programmed the secondary settings into an infusion device if I was using one, but in this case I'm not using that. So I'm going to open the clamp. I'm going to open the clamp on the secondary bag tubing, and I will ensure that I see a secondary solution flowing through. Now I'm going to check and make sure that my primary infusion resumes as its set rate when secondary volume has been infused. Also, I'm going to, when my secondary bag is empty, I'm going to readjust the rate of administration into a primary solution to the desired flow. Just to note that the secondary tubing has to be changed every 96 hours. Now I'm going to, before I leave the room, I'm going to lower the bed of the patient to its safest position. Then I'll place the patient's call light within reach, probably give them water, bring their table closer, everything that they'll need. And then I'll take off my gloves and wash my hands, and then I'll document about everything. That is my video. I hope you guys enjoy it. Thank you.